Hi, this is Walt Fritz from Foundations in Manual Therapy Seminars. The primary class that I teach is my manual therapy for voice and swallowing disorders, and I often get some people a little confused possibly on who exactly this class is targeting. Well, certainly a primary population is the speech pathologist for all the various patient populations as they work with, from peds to geriatrics to post-head neck cancer, vocal disorders, as well as the performer. But I think a really interesting crowd that come to see or to take this class are other professionals. And at first it might not seem that a manual therapy for voice and swallowing class would be pertinent to the massage therapist, physical therapist, occupational therapist. But actually they find a whole lot of value in it. Some people are working with, for instance, the voice performer, or dealing a lot with neck pain, facial region issues, TMJ, oral motor disorders. We cover a lot of different ground in this seminar. And when people come to the class, I say, most people come here thinking they're going to learn a new set of hands-on skills, which I certainly hope that they do. But what I really hope they leave with is an understanding of shared decision-making and how sharing decisions in the therapeutic environment can benefit the therapist or the patient, well, the therapist too, but the patient, in ways that the traditional clinician as expert model can't. It's a tough model for some people to adapt to, especially if you've been trained in that I'm an expert, because I took a whole tier of training. It's sometimes a little difficult to separate yourself from feeling you know what's best for another human being. And that's a core component of the class, that as it's taught, that while I know a lot, I'm an expert in a lot of different things, I'll never know what another person is feeling and fearing and hoping for and valuing until I include them in the conversation. Another group of clinicians who attend the class are those who are working from a myofunctional perspective. While this isn't a myofunctional training, we have a lot of crossover and overlap with the oral motor, neck region, tongue, etc. techniques that we present. Some of the newer work that is included in this class, it's not just about that stretching, that sense of manual therapy, but we're including a lot of concepts relating to strengthening, whether it's the thought of a traditional exercise for strengthening, or exercise is something that goes from peripheral to central, and the brain and central nervous system then figure workarounds, figure out new ways to accomplish it. I especially see this in some of the tongue work that we do. Yeah, we do some tongue stretching, but we also do a lot of tongue engagement, awareness, exercising, strengthening throughout that oral motor cavity, as well as laryngeal exercise, if you will. So I think if you're interested in the class, please reach out to me on social media or check out the website at waltfritz.com. I think you might find some value in this class. Thanks for listening.